I want to introduce you to, again, Sonya McKenna. Thank you so much for joining us today.
You're very welcome.
This is a unique and interesting area of, and I don't know how you characterize it. Some folks say spiritualism. Some folks say that it's psychic, occultism. What is it?
I see my work as a form of mysticism, but it's blended also with psychology.
Okay. How do you do that? That's an interesting mixture.
How do you do that? That's a good question.
Is it because you have a rather deep and visceral knowledge of behavior and pathology, and I guess the combination of a learning in both of those areas?
There certainly is a skill set that I bring to the table.
Okay.
I have a doctorate in naturopathy, and I'm a
Okay.
certified natural health practitioner. So I come with a background of understanding the physical body
Okay.
and illness and what natural means are necessary to heal the body. But from there, I think I've taken my own natural abilities of sensing what is going on in a person,
Okay.
and I've combined that with I should say a couple of different techniques that are a methodology of looking at the bodies, and
Well, if
that
someone comes to
provides
you,
the framework.
if someone comes to you, and if you could just describe the process, the reasons why they would come, and ultimately how you would interact with them, intervene perhaps with them, and then what would be an expectation?
Okay. In my practice, I see people as individuals. I also work with businesses, helping them in their environment. So it's two different things. I'll start with in a business environment. I would look at the dynamics of what is going on within the group, what the goals are of the company, and I see what is blocking the people from reaching those goals. And then I also work individually.
Well, let's talk about businesses, and we've been talking about the big three.
Mm-hmm.
Is this the kind of situation where someone might call you to kind of get further insight into what they are facing, what obstacles may be there, blockages, to use your word? Is that the kind of situation where you would intervene?
I certainly could, yes. Yeah, I
Okay.
haven't done anything at that level of a corporate level, but at a business level, yes.
Okay.
And
Or even a city like Detroit. My goodness, we've had a number of issues that we've dealt with. Just think about it for a minute, and maybe we'll come back to it. In terms of what is it that Detroit may need more than anything else that's going to help us to survive these very difficult times. We're going to allow you to call in as well. Sonya McKenna, if you have perhaps some issues, health,
certainly.
issues, she can respond to some of that, or maybe it's some psychological issues that may be preventing you from actualizing who you are and your greatest potential. Then you might want to give us a call for that as well, or we can talk about some of these other things. So go finish the process, and I interrupted you. You would identify someone would come to you, someone representing a corporate interest or individuals that would come to you, and you would then do what?
Okay, so let's say I have an individual in my practice who comes to me and they're experiencing some depression, and perhaps their marriage is unhappy.
Okay.
We would have a discussion, or it's not even necessary because I have people who just call me by phone, and I don't need to know a lot of detail. But then I would take a few moments and look at their energy field, and I tend to write down what I see, and then item by item we look at that, and together we clear it. And the clearing it takes intention. I like to take a breath with the person, and the item is cleared off their energy field. There's a lot more that's embedded in that based on my training, but I've simplified it to that point. So it looks a little bit magical, but I get great results.
And you can do it in a kind of remote, I don't want to say remote viewing, that may not be accurate, but you understand what I'm talking about. Over the phone, if someone wants to call you and that issue exists, perhaps you can have a short conversation and maybe even demonstrate exactly how that works. Somebody that's very, very concerned about this situation again with the city. You have any sense of what people are and I guess maybe it's my own little psychic hat. This whole idea of like RoboCop, where anarchy reigns, and that's what people tend to begin to feel. What do we need to do to sort of prevent ourselves from not necessarily being abused by these individuals, but even being abused by the expectation?
Right. I think what needs to be addressed for the people themselves, the citizens, is their own mindset. And where you have fear tends to attract negative events. So it's important to eliminate that and form positive expectations like you're talking about. It's interesting that she brought up prisoners being released because that's a venue where I'm trying to expand my work. I've spent the last year working with homeless teenagers through Covenant House, and I've seen great results with these children who've had very traumatic backgrounds with a lot of abuse and a lot of hardship. And I know that I can take this technique in a group setting and work with convicts as well.
How much of it is actual a kind of group counseling session, and a kind of natural thing would happen with a psychologist, for example, and how much of what you do is kind of an intervention that's zooming in from the ethereal that fixes some things by way of that method, unbeknownst to individuals who are what it is that you're doing, unbeknownst to them, aside from the conversation.
It's interesting that you brought up talk therapy because I've had different people comment that what I do is much more effective than talk therapy, much more rapid. People can spend years talking about something and never be able to move through it or eliminate it. And sometimes, in a very rapid amount of time, a minute to or so, it can be completely removed.
What's the science, Sonya McKenna? What's the science behind that?
The science behind that is expanding more and more all the time. There's some great books out which involve energy medicine. I know we have things like Carillion photography that can look at the energy field.
Which has been around for many, many years.
Right. I mean, the government has been using the mental sciences quite a bit.
Remote viewing.
Yes.
Yes.
Yes. And in the medical community, you're seeing more and more medical intuitives who are able to look at a body and see illness, see cancer, see weaknesses, pathologies, and are giving people guidance as to how to address that.